Hello, everybody. This is MJ, the coding coach, and I am back. So, a lot of times, people ask me the same question when they ask me how in demand is the CRC or the Certified Risk Adjustment Coding Credential or Certification. It is in high demand. You will find more people with their CPC than you find with their CRC. Why do you think companies are willing to train those who have their CPC or CPC-A? That's because there's not enough coders with the CRC credentials. So they say, hey, if you have your CPC, although it's different training, we'll teach you because we need people so bad. So with this chart, you can find this in the Aapc CRC study guide for 2024 on page 93. This guide is going to help me show you guys why risk adjustment coding is so important and why it is important to be a great risk adjustment coder because it deals with money. We know that healthcare is a business. Of course, it's here to help us, take care of us, look after our health. But at the end of the day, healthcare is big business. So let me break this graph or this chart down to you. So let's say in the first column, we have a coder who is not a great coder at all. This coder doesn't capture the right codes from the medical charts, not capturing the diagnosis, none of those things. So we'll say the second column is a mediocre coder. This coder is okay, they're decent, but they're not great. Let's say in the third column, we have an amazing, superb, excellent medical coder. So let's go through it. So if you do not know, when these patients are under these risk adjustment plans, they get what you call a RAF score, RAF, risk adjustment factor. That score is based upon a few factors: their age, their sex, are they eligible for Medicare, Medicaid? There are a few factors that are factored into coming up with this score. In addition to that, the score is also based upon the diagnoses that the patient has. So we don't have to know the exact amount that's weighed on these diagnosis codes. You know, we have software and things like that that does it for us. So, but you do need to understand this graph and understand everything about risk adjustment to be a great coder. So in this chart, we have a 76-year-old female. So first column, where we said we had a coder that's not good at all, this patient is going to receive 0.468 in the score, which factors into this RAF score I'm telling you about, just for being a 76-year-old female. Another thing I want you guys to understand is the higher the RAF score, the sicker the patient is. And the more money that these plans will receive or plans will give for this patient because it costs more to care for them. The lower the RAF score, the healthier the patient is. They're going to collect these scores from January the 1st through December the 31st. It starts over every year, January the 1st. And all of the diagnoses that a patient receives during that year, that's how their RAF score is accumulated along with a few other factors. So in this first column, for being 76 years old, this patient is going to receive a 0.468 score just for age. Remember, I told you there are things that are factored in other than the diagnosis. So this patient also is Medicaid eligible. So it's going to be 0.177 just for being eligible for Medicaid. So this coder that coded this first set of charts, they did not capture any diabetes. They did not capture any vascular disease. They did not capture any congestive heart failure. So there is no disease interaction score to factor in as well because the coder did not capture these things. So we're pretending that a medical coder is going through a medical chart and is supposed to capture these certain codes. So this patient's total RAF score is 0.645. So PMPM stands for per member per month, which means this health plan is allocating $452 per month for the care of this patient. That's not much money. But as you see, this patient is not sick. They don't have any diagnoses, so of course the money is going to be low that this plan is receiving for this patient, or this healthcare entity is receiving for this patient from the plan. So yearly, this patient is only accumulating $5,400. So let's say that we have a mediocre coder in the second column. So for being 76, this lady still gets her 0.468 score. Medicaid eligible, 0.177. Diabetes, but with no manifestations, meaning no complications or anything. So that's weighted at 0.118. This patient is also found to have vascular disease without any complications. So that's going to be a 0.299. So there are no disease interactions to factor in. And just understand, when certain diseases are coded together, they have what we call a bonus for a disease interaction, because these diseases are interacting. So you're going to get a bonus score, which raises the amount of revenue, because with those additional interactions, it's going to cost more to care for this patient. So the total RAF score for this patient is going to be 1.062. Now you see how their RAF score has raised from 0.645. That's because we factored in some diagnosis codes. This coder actually captures some things. So the per member per month payment for care is $743 a month. Now keep in mind, this is the same patient. We're just going through if it's a okay coder, a mediocre coder, and an excellent coder. So in this middle column, as you see, the money or the revenue has raised from the first column. Even the yearly reserve for care is $8,900, up from $5,400. So now let's say we have an amazing, excellent coder, just like you guys are, or if you're an inspiring coder, just like you guys will be. So this same patient that we've been talking about, of course, they're going to get their score, their 0.468 for being 76-year-old female. They're going to get their 0.177 for being Medicaid eligible. Now they say the diabetes with vascular manifestations. So this is going to be a 0.368. Vascular disease with complications, 0.41. Congestive heart failure, 0.368. Then there's a disease interaction bonus for the diabetes and the congestive heart failure, which an additional 0.182 to the score is added. Now this patient's total is 1.973 as a RAF score. And remember, I said the higher the RAF score, the sicker the patient is. Look from column 1 to column 3 with the diagnosis added. You see that adds to the RAF score. And again, the higher the RAF score, the sicker the patient is and the greater the disease burden. So now you see the per member per month payment has jumped to $1,300, almost $1,400 a month. And of course, they have to receive more revenue because this patient has all of these things going on. So it's going to cost more to take care of this patient. And the yearly reserve for care is $16,573 for the year for this patient. Now look from the first column to the third column. Look how much of a difference this is. So that's why companies are looking for medical coders who have their CRC, their Certified Risk Adjustment Coding Credential, because this says to the employer, this person or this coder has been specifically trained and knows all about risk adjustment coding and the methodologies. It's very important as medical coders, period. And it's, risk adjustment, since that's the subject, it's very important to capture these codes. Because what if this patient is having all of these ailments and you're leaving off the codes? That means their healthcare entity is not receiving all of the money they're supposed to receive to care for this patient. So again, to those who are asking me, is risk adjustment coding or HCC coding in high demand? It is very much so in high demand. You don't have to take my word for it. You can look on Indeed, the job search site, or you can look on LinkedIn. Type in risk adjustment coding, and you're going to see a plethora of jobs to pop up. So if you have any questions about risk adjustment, drop them in the comments below. I'll be glad to answer all of your questions. My next course is going to be April through June of this year, and registration will start on February the 1st. You can click the link in the bio to send an email, or you can give us a call Monday through Friday from 9 a.m. to 7 p.m. Eastern Standard Time at 800-977-1550. Thanks for joining me. MJ the Coding Coach, and I'm out.